Hello and welcome back again. This is episode 3, and today it's going to be a very special guest with us. So, we're going to talk about women's health and physiology, especially when it comes to sports field and competitive athletes with females. Our guest today is Dr.Asil Jallad. Hello, Dr.Asil.
Hi, Nadine.
So, how are you? I'm really happy to have you today with us. So, Dr.Asil, if you may allow, I'm going to just introduce you a little bit. So, you are an OBGYN college specialist. You graduated from the Jordan University of Science and Technology.
Yes.
And currently, you have your own private practice in one of the major hospitals in Amman. I'm privileged to be part of your residency when you were doing your residency, when we were, let's say, small kids at that time, probably a decade ago. Oh yeah, time is flying by. So, Asil, you would probably, or people would ask, why would I bring in a OB-GYN specialist to talk today? As I probably or that I have got recent interest mainly in doing female athleticism or sports and so on. And the area of female physiology and the understanding of how our menstrual cycle adapts to our sports training is still lacking. The data there is not mature or not even spoken about much. And there's been recent papers publishing about this, yet still lagging. So to start with, I would please have you to talk about a little bit about our menstrual cycle. What are the phases and what are the definitions of them, please?
Thank you, Nadine, for bringing an ear to this, or attention to such a topic. عشان, as you said, it's been underestimated, whether socially, publicly, and even in the medical sector. It's not given much attention. To start with, it's not given much attention to look at the menstrual cycle as a cycle. We all know that we just bleed once every month, and that's where the attention is. And then we look at when we ovulate, and that is it. But no one looks at the whole cycle as a cycle from beginning to end and what happens in between. It's good to always mention that our menstrual cycle is divided into 4 phases, 4 major phases, during which our hormonal cycle changes. And this is why we bring attention to everything related to these changes, including exercise, like when it is best to exercise, how the endurance and the performance changes in each phase of the cycle. So it's very important to bring an eye or an ear as well to the phases of our cycle. It's very important to know the divisions, where it starts and where it ends, and how our hormones change during that time. We all know that the main control or the control center of our cycle and our hormones in general is our brain, the hypothalamic pituitary axis. So we're talking about hypothalamus, that's the gland in our brain, and the pituitary gland that controls the release of hormones or the production of hormones from our ovaries. So again, it's when we talk about it, we talk about a whole axis of it. Hypothalamic pituitary ovarian axis, and this is what's brought up in science everywhere. When we read any article or paper, it talks about hypothalamic pituitary ovarian axis. How does that change? This is what we need to know so we can relate it to our exercise and performance. We know there are 4 main hormones controlling our axis, or we as females, or us as females, in terms of reproductive health. We know we have 2 hormones that are released from our pituitary gland, which are the FSH and the LH, the follicle stimulating hormone and the luteinizing hormone. We're not going to talk about them a lot because they don't concern us directly in detail. The 2 main hormones of concern are the estrogen and progesterone that are produced by our ovaries, yes, which are controlled by our hypothalamic pituitary axis. So what we need to know is our cycle starts with the first phase, which is menstruation. It's the bleed or the withdrawal. And that's when all our hormones, all 4 hormones, are in their lowest level. Now, that menstruation leads to our next phase, which is the follicular phase. That's the second phase of our menstrual cycle. Now, this is where our hormonal changes start. And this is what we're going to talk about later with like the whole issue of discussion is that are the changes that are going to happen to our estrogen and progesterone at that time, leading to our third stage, which is the ovulation or the ovulatory stage, which is the concern of most ladies, or at least in our region or in our part of the world. Everyone is concerned that I had my period during that time, so when is my ovulation? And no one looks at the in-between. So basically, we're talking about the ovulation. That's the third phase, which is preceded by a very important hormonal change or a hormonal surge, which is the LH surge and the estrogen hormone. That's one of the peaks of estrogen. That's taking us to our fourth and final phase of our menstrual cycle, which is the luteal phase. And that's probably the main part of our talk today, which is the luteal phase, because when we talk about luteal phase, we talk about estrogen-progesterone ratio. And that is when estrogen and progesterone are both elevated, but what concerns us is the ratio of estrogen to progesterone. And that's what controls our physiology, specifically our exercise physiology. So to cut it, like in short, these are the phases of our cycle that will lead to our discussion later on.
Yeah. So as you explained, we have 4 phases, as you said. Starts from the bleeding. You've got the follicular phase, which that's where the estrogen predominates.
Yes.
And then the ovulation. And then you go, the estrogen starts to decline in the luteal phase, and the progesterone tries to control that area, and then that's where the bleeding and so on. So as, let's say, females who are going to start working out, when you're looking at the follicular phase, the follicular phase, what are the most symptoms associated with females? Like, let me tell you about myself. Like, we've been told that it's best to work out during your follicular phase because your estrogen is high, and it mimics the testosterone in terms of anabolic growth, and that's where you can do the high intensity exercises. So I would love to hear from you more.
Okay, so it is right and wrong, if I must say. Now, that's the thing. If you remember what I said when we spoke about the phases, we said the follicular phase it transitions to the ovulatory phase. And it's very important to look at it in that aspect where it transitions. I agree with you. Our estrogen is at its most in our follicular phase. But again, is it the only thing we look into when we exercise? Is it just the estrogen? No, it's the estrogen-progesterone ratio that concerns us most. Because, again, I think we don't want to go into a lot of details in that aspect. But if we look into it, it's not solely estrogen. And we're not talking about a single hormone. We're looking at a ratio of estrogen to progesterone. It is right that at a certain point, it's very important to look at where is estrogen at its max, because it is the hormone that's needed for better performance, better endurance, and so on. But again, is it all of the follicular phase? No, it's exactly the pre-ovulatory phase. That's when the
pre-ovulatory phase.
That's when our estrogen surges, at its peaks, and then this is the phase where, yes, our performance or our endurance can be at its best. But again...
Can you say that? Sorry, is it like day 10?
It depends on the length of the cycle. Now, it depends from one woman to another, because if we want to talk about a menstrual cycle, it varies. It varies from a girl to a girl, a woman to a woman. The shortest acceptable cycle is 21 to 23 days, and the longest acceptable cycle could be up to 38 days. Now, the fixed part of the menstrual cycle is the luteal phase. That is the last 14 days of the cycle. These are fixed. But when we're talking about a follicular phase, it changes and it varies from one woman to another depending on the length of the whole cycle. Right. So the pre-ovulatory, for me, it can be like my day 10, 12, that is it. But for you, it can be a day 14, 16. For another girl, it can be 8, 9. So it depends on when we expect our ovulation to be. This is when we look at our pre-ovulatory estrogen surge. And this is one of the phases of our cycle where our estrogen is at its best, and we expect our performance to be at its best. And so that's the first part of our cycle where performance is at its best.
Because I always, like, when I'm looking at my data, for example, looking at my, let's say, respiratory rate, it's really well, it's lower. I even have a better sleep during my follicular phase, less stress. when I jump into the luteal, especially at the end, I really feel my respiratory rate is increasing, my sleep is irritable, my resting heart rate even goes higher. So I think these physiological dynamics does change.
That's a reflection of your hormonal change, because again, we said that the maximum, or when we have two phases in our cycle that are best for performance. The pre-ovulatory is one of them. The mid-luteal is the second one. So when we're talking about a fixed luteal phase, that's the last 14 days of our cycle. The middle of it, or mid-luteal, is where our the second part of our cycle, where our performance is at its best. But you're talking about right before your period, that's the end of your luteal phase. So at that time, we don't expect an estrogen-progesterone ratio that is healthy enough for better performance. So again, when we talk about a phase, we shouldn't generalize or give it a full spectrum. We should specify what part of that phase we're looking into for, again, because athletes,
each phase is classified into three subtypes, like luteal, early luteal, middle luteal, and late luteal.
So mid-luteal is our target. Well, again, it's different. Like when I talk about it, again, I'm not an athletic person. I'm just a doctor. I exercise. Yes, just exercise before your cycle. But when we're talking to someone who's an athlete and who's very concerned about performance and endurance, especially like the high-intensity exercise that you guys do, like the running and the cycling and so on, numbers do count for you. Like your performance does count, and how well you do does count, because it's competitive sports. So this is what you're looking into. That's why you need to specify your performance phase.
There was a paper recently published by the International Sports Society, and it was really interesting, by Dr. Stacey Sims, if you've heard about her. She was the main investigator. Anyhow, she did some touch bases on the protein requirements, especially for females in the luteal phase, because that phase is where the enhanced oxidative catabolism increases. And she stressed out that your protein intake should be higher in that stage, like approximately 12% higher than the other stages.
That's at the end of your luteal phase, again, because of what we said. We said that the estrogen-progesterone ratio is at its highest mid-luteal. That's when estrogen kind of peaks mid-luteal. But again, towards the end of your luteal phase, this is what happens. Estrogen goes down as well as progesterone.
So that's the reflect of progesterone then.
Now, progesterone kind of, I don't want to say it opposes estrogen, but the effect on catabolism and anabolism, estrogen encourages anabolism, while progesterone encourages catabolism. So again, so this is what happens towards the end of your luteal phase. You need an added protein intake to counteract the effect, because you have lower estrogen. So this is what you need. So your level of performance can reach out to the phases where estrogen is at its peak, which is pre-ovulatory, mid-luteal. So towards the end of your luteal phase, to counteract the effect of dropped estrogen, you need to increase your protein intake.
Your protein intake. Yeah, absolutely. So she stressed on three stuff, like to recommend at least directly after the workout, a 0.4 grams per kg. Let's say 0.4 multiplied by 60. That's around 25 grams, which is a scoop of protein, for example, after your workout, to enhance the muscle remodeling.
Indeed.
And also, and that also for females who are in their peri and postmenopausal phase, they should aim for higher intake also. And the protein should be equally divided every 3 to 4 hours. Well, there's another question for you, Doctora, regarding progesterone. So how does it affect the aldosterone when it comes to fluid retention?
Again, go ahead, sorry for interruption.
So the thing is, females in that phase are more prone to hyponatremia.
صح. And that's because of its effect on your cortisol cycle. Again, that's the whole thing when it comes to estrogen and progesterone. When we talk about the overriding or the change of estrogen-progesterone ratio, that's when estrogen drops and progesterone overrides, let's say, or in general, it's the result of estrogen dropping. It affects metabolism in general. It's not just your aldosterone metabolism. It affects your cortisol cycle. It affects your thyroid cycle, and it affects the whole anabolic function of the body, and it affects the whole metabolic function of the body. So it affects the energy availability in the body, and as a result, it affects your...
Yeah, I'm mentioning that. Why? Because for runners, for example, or when we're cycling, let's say in hot climates, usually you need to hydrate yourself.
Yeah.
And when you're already over fluid, like you've got the aldosterone opposed effect, and you overhydrate, you probably might be prone to some sort of hyponatremia. And by the way, it is evident in some athletes.
It's logical if it's not just in athletes, but if you overhydrate, or if you're overloaded, if you want to go for like a lay language word, if you overloaded with fluids, it's going to result in like excess fluid compared to less electrolytes, and that leads to hyponatremia. That's fluid collecting. Yeah, and that's fluid collecting in extracellular spaces. So this is what's going to happen.
Talking about that, I have a question for you. So many females come in and say, yeah, my weight is increased because now I'm just in my menstrual state. How much weight does really the female gain in that?
We can't talk about, like, it's not more than 1 kilogram. That's like almost 2 point something pounds, to 1 to 2 kilos max. So you're talking about 2 to 4 pounds at its max. So that's the excess.
That's a lot.
But again, when we look at it as a percentage of your total body weight, it's not. Because again, you look at a total body weight, most of our body is water. Again, let's not deny the fact that this is what constitutes our bodies. Most of it is water. Right. And again, it's temporary. Right. It's not permanent. So that's the good thing.
All right.
The moment your hormones drop down, your metabolism will go back to its norm. Your electrolyte balance will go to its norm, and then you're gonna get rid of the excess fluid. So that's it. It's temporary.
Interesting. Now I would like to shift our talk a bit about the perimenopause woman.
Yes.
It was really interesting, these category. Usually their symptoms starts 4 to 5 years before going into menopause. So would you just give us a glimpse about what do they really face, and what are the early signs and indications that they know that they're going into perimenopause?
Well, again, perimenopause is a state that's around menopause. So you're not menopausal yet. And you mentioned that it can be 4 to 5 years before. Some studies actually report these symptoms as early as 10 years pre-menopause. So the phase of perimenopause can go as early as 10 years pre-menopausal. So you might start getting these symptoms at the age of 40. Now, the main reason for getting the symptoms of perimenopause and eventually menopause is hypoestrogenism. So that's a drop in your estrogen level, and then leading to you, let's say if I want to go for, a non-medical word for it, but you're going to age, you get the symptoms of aging earlier. That is the loss of bone density, vaginal dryness, loss of energy, dryness in your skin, lower metabolic rate. So basically all symptoms of decreased estrogen, you start getting them in the state of perimenopause, and they gradually worsen, if you want to say that, until you get to menopause.
So is it true, like you mentioned earlier, that the luteal phase is a fixed phase?
Yeah.
In terms of days?
Yes.
So what is it that in the perimenopause, does the luteal phase get reduced?
It's the follicular again.
It's a follicular.
Yes.
Why do they then have estrogen flash?
They don't.
Like hormones or
no? They don't. The estrogen drops. That's the whole reason behind symptoms of perimenopause, and that's basically when we talk about menstrual irregularities in terms of oligomenorrhea, amenorrhea, perimenopause, menopause. If we want to look at one word for the reason or the cause for all of these scenarios, is hypoestrogenism. reduced estrogen.
Hyperestrogenism. So that's why they also during this phase they have increased protein breakdown catabolism, the
Indeed.
insulin resistance
Increases.
increases, the abdominal obesity decreases, and as you said, the bone density increases, and that's why
Decreases.
we encourage females, especially probably in their late 30s, mid 40s, to enhance their exercise in order to save or to adopt to these changes. Yes.
To compensate.
Yeah. So to compensate. Now, I would like to talk about, to be honest, this is the hot topic for me. That is low energy availability in females, or what so-called is the female triad athlete.
Yep.
Well, just a scene before starting, I was one of the people, when I went into this field, I used to go like, yeah, I don't want to do a full marathon because I'm afraid to lose my cycle, because it's stressful and I'm young and I'm still age bearing, and I believe that losing your cycle is a consequence, okay, and then until I got deep and digged into this topic and I realized it's the low energy availability that distributed or contributed to this phenomena. Can you please explain more?
Yes, so I just wanted to say chapeau to you that you actually looked into it and refused to get yourself to a stage where you can lose your cycles. Because again, let's not deny the fact that periods are important. Getting your period, even if it's irregular, even if you're oligomenoric, that is, if the number of the periods you get per year is less, that's fine. But losing your periods for longer than 3 to 4 months, that is not right for any girl, any female, any woman. Because again, as we said, your menstrual cycle is a reflection of a normal hormonal variation that maintains your health as a woman. So anything that impairs this, which is what you mentioned, the female athletic triad, or the new terminology for it, which is the low energy availability. So if you want to talk about low energy availability from the term itself, it's basically where our intake is less than our consumption. So that means we're consuming way more fat from our bodies than we're actually putting in. That will get to a point where we lose so much fat to an extent where it disrupts our hypothalamic pituitary ovarian axis, leading to a reduced stimulation, decreased GnRH, that's the gonadotropin releasing hormone, and that will reduce or put down the stimulation to our ovaries, and that will lead to reduced estrogen and progesterone as a whole, leading us to a stage where we're not getting the normal hormonal variation, and as a result, we lose our periods. And again, that will take us into a level where we have women or girls at the age of 24 and 25 whose bodies are behaving as if they're perimenopause and menopausal because they have no estrogen. And again, what is the consequence of that? Osteoporosis, losing bone density, messing up with their thyroid metabolism, insulin resistance, and the whole spectrum of hypoestrogenization.
So yeah, this is honestly a huge topic,
yes,
especially when it comes to now, as you're seeing the females start to work out or peak up in their adolescence.
Indeed.
You're talking about from 16 years old and let's say to 25.
Yes.
The thing is, we don't know. I don't think the coaches are aware enough about, or even asking whether they have their cycle or not. I don't know if these females are well educated on the importance of having regular cycles. Yes. Again, especially there's so many sports that are sensitive to weight. When you're talking about running, cycling, that really impacts their performance, and losing every 1K makes a difference.
So they're driven.
So what they do is they restrict eating by increasing their fasting time.
Yes.
Or they go binge eating.
Sadly.
Just have it all in once.
Purging.
And probably I've heard people using diuretics, yes, using laxatives, even, or even self-induced vomiting in order to.
So sad. It is sad.
Yes. So it's sad. The thing is, I've heard females saying, well, let's say those who are in their mid-30s, well, I don't care. even if my cycle doesn't come, I'm not going to have any child. So what do you think? Could you please just
Again, as you said, Nadine, it's the lack of awareness, lack of education, and it's basically the drive of performing better, getting better numbers, excelling in my sport. So it's a combination of factors. Again, if we want to put it in one word, it's multifactorial. Is it actually the psychogenic part, or the stress, or the joy of having better performance and better endurance and so on, because they're not getting their periods? But what they don't know, that this effect is only temporary, because with time their bodies are going to age way earlier physiologically than they're supposed to, because of the loss of the hormonal cycle, leading to a sped rate. It's going to be the rate of bone loss in these women. Like, it was, some studies actually showed that up to 40 and 60% of female athletes have an added rate of bone density loss per year. That means they're going to get osteoporosis way faster than other women. So that means they're going to get osteoporosis mid-30s. So they're not going to be able to perform better anymore. So that's what they don't know. I might be like driven or excited by the performance I'm achieving in the 1, 2, 3 years. But what's going to happen if I'm not getting any periods 3 years down the line? If my estrogen does not go up, if my estrogen keeps going down, and I'm losing way bone density year by year, I'm affecting my thyroid metabolism year by year, I'm affecting even my glucose metabolism, my fatty acid availability, my proteins metabolism. Again, we said estrogen is very important for my anabolic rate, for my metabolic rate, for all of it. So if I'm breaking down but I'm not building up, what's going to happen? I'm going to lose it. I don't have storage. I'm not going to have any storage left.
So the thing is, I want to ask you, how can you tell if a patient comes into you and she tells you, I'm an athlete, and she seems underweight? What are the physical appearance that really can tell you that this lady is really low energy?
Okay. So we call it like she looks cachectic, like malnourished, or underfed, or when you talk about like a child or a teenager who's malnourished, is basically bone prominences are showing, the skin tone and the skin color. Sometimes you have like we call it lanugo hair. Lanugo hair is basically the you know how when the baby is born, the babies when they're born, they have something that's called lanugo hair on their bodies. It's like the immature hair growing. It's like they're furry.
Baby hair.
Yes.
You mean?
Anorexic women or anorexic girls, they tend to become hairy. In addition to being skinny, the skin color is more earthy and pale. You can actually see their bones prominent, whether it's their facial bones, their ribs. They have way more bony prominences. The loss of muscle mass, the loss of fat mass, because again, being so skinny is not healthy, because you do need your muscle mass and you do need your fat mass for a normal hormonal balance, for your normal metabolic balance. So again, the loss and even if they're happy and they're just athletic and they tend to move way easily, but when you look at it, they don't have the endurance they think they do have. That's like clinically from the outside. But then again, we can tell by blood tests as well, and by scanning tests. Like there's a bone scanning test where there's a scan to measure the bone density. So in these women, the DEXA scan, exactly. So if we suspect, or if a woman comes to me and she hasn't had a period for more than 6 months, that raises an alarm for me. I need to check her bone density. I need to check her hormonal levels, in addition to being clinically examined, because she can be like malnourished, in addition to having hormonal abnormalities, in addition to she might be having osteoporosis. Who would know? Because osteoporosis is a silent illness. Again, you can get loss of bone density. You can be osteopenic and osteoporotic, and then, you wouldn't know unless you fall down and you get a fracture, and then no one can tell.
Yeah. So I was reading that usually these ladies, what happens is they go into general fatigue.
Yeah.
And then after that, the metabolic rate reduced, and that has some sort of secondary impact on their skeletal health, and consequently probably on their cardiovascular system.
All of it.
And probably silent cardiac arrests.
True.
I don't know if that's true.
No, it is true, because it's been reported. Like, as you said, when we talk about the effect of low energy availability on athletic women, it's not a subject that's been given a lot of attention. But more
No.
attention is given to perimenopause/menopausal women. But when we think about the physiology of it, there's a lot of resemblance between the two scenarios or the two situations. So when we look at perimenopause and menopausal women, because of the reduced estrogen levels, they found out that way more women die of cardiac diseases in their young age or in their reproductive ages than men. And why is that happening? Because estrogen is less. So again, when we talk about athletes, their estrogen levels are so low if they don't actually look about or they don't balance their intake to their output. So this is what's going to happen eventually, and we don't want to get there, because when we talk about athletes, we're not talking about perimenopause. We're talking about women in their 20s and teens, as you said.
Okay.
So it's kind of alarming.
So when you mentioned earlier about menorrhea,
Yes.
exactly, and it's fine that a female can. Isn't that a sign or indication that the female is
There are
having
many.
some disturbances?
Yes, it can be in certain scenarios, but not because when we talk about oligomenorrhea, it's not just a situation or a scenario that just take place in athletic women. When we talk about normal cycles, it's a normal cycle where women get it like an average of 9 to 12 periods or 9 to 14 periods a year. But when we talk about oligomenorrhea, that's getting less than 6 cycles a year. So that means you have less than 1 period every 2 months. So that can be an indication of having a hormonal issue. In the past, they used to say you need at least 1 period every 3 to 4 months to be healthy or to ensure health. But most recent studies say no, you need to get a period every 2 months, because they watch the effect of the loss of your hormone cycle on your general health. I'm not just talking about your reproductive health. We're talking about general health now. So we're talking about even your skin tone, the way you're like getting your nails to break or your hair to pull out. That's what reflects on your health.
Does it impact the skin?
Yes,
also?
of course. Because again,
Okay.
estrogen is it's the female hormone. It's what makes you a woman. It's the hormone that's very important for us to behave as females. But when they look at athletes, that's the sad thing as well. They look at athlete women the same way they look at athlete men. Hello, we're not the same. They shouldn't compare. They shouldn't compare women athletes to men athletes, because our bodies behave different in everything.
All right.
So it should be given more attention.
I have a question also. When we're looking at let's say at the bleeding.
Yeah.
Sometimes you have some cycles that you've got heavy bleeding,
Yeah.
some cycles are low.
Yes.
Does that reflect anything?
It's more subjective. Again, we can't be objective when we measure the amount of blood we lose, but we look at the consequence of the blood loss. Again, it can be like, I can tell you that I had a heavy period at one point, but then the next month I will tell you I have a light period. What decides that? Again, we ask the girls if they come to us or they present to us in symptoms of like general weakness or tiredness or palpitations, like any sign that we suspect they can be anemic or they're losing blood somehow. The main reason for women to be anemic is their periods. So if we have an alarm that's raised due to a woman presenting with general symptoms of blood loss or anemia, this is where we look into these symptoms, where we suspect that she can be having heavy periods and she's underestimating them. So the thing of concern to us more is the amount of blood towards the higher end. Like if she's losing more blood than she expects, and she's underestimating the amount of blood she's losing.
I'm asking that because I'm talking about a personal experience. When I used to do some like prepare from some races or increase my volume.
Yes.
I really see that my bleeding, like gets shorter. But when I'm feeling better, it's just it goes on to normal like 3-4 days.
No, it can be shorter, but then again you might get 1 day of a heavy bleed that like compensates for the 3 days.
Yeah. Okay.
So again, it's more subjective. Like on 1 day you can. So it's more subjective. We look at it. We ask certain questions to be able to assess the amount of bleeding a woman gets, because you can't actually measure it. So again, we have to be sensible and subjective.
I have also another question. So we have some athletes that prefer to be on oral contraceptives. And those implants, that some of them, they take it to induce secondary amenorrhea.
Okay.
What are your thoughts on this? And as if like they induce secondary amenorrhea for a year and 2 years, by the way, and they feel good about it because they can train properly. They feel like, cleaner. I don't know. What's your comment on this?
It's I always tell it to my patients when okay, I'm going to give you another scenario that kind of resembles this. We have we're not going to talk about it now, but you know how we have this condition that's called polycystic ovarian syndrome, the PCOS. It's one of the main causes of secondary amenorrhea. So a lot of women just come to you and they're like, no, I'm happy with a pill. Just give me a pill so I get a withdrawal bleed every month. And that means I cured my PCOS. Hello, you're fooling your body. So that's the same thing that happens. Again, what they're doing is they're just either inducing amenorrhea or inducing a withdrawal bleed every month that's exactly counted per day when they're on the oral contraceptive pill. And hello, what about the store? What about your consumption rate? What about your output? What about your intake? Have you actually looked on other parameters? You're just inducing a withdrawal bleed. You're just fooling your body by giving external hormones. Hello? What about your production? When you're taking an external source of hormone to induce amenorrhea or induce a withdrawal bleed, then you would actually hide an inner problem or hide a core problem that's not showing. Because what's happening is you're giving your body external hormones that kind of resemble the normal cycle. But what about the production that's happening inside? Is it actually working on the right track? No. So I'm not at all with hormonal supplementation unless I do a full investigation. I do a full workup and assessment to every athlete who's not getting a period for a reason or another. As I said before, it's a 6-month cutoff. If she doesn't get a bleed, then she needs assessment. We measure the consumption rate compared to her intake. If it's not balanced or there's an imbalance somewhere, that means she's having low energy availability. That means she's suffering or she's getting amenorrheic or oligomenorrheic because her hormonal axis is being disrupted. And that needs a look at the actual recovery, not at the external consumption, not at the external intake of hormone or external supplementation of hormones. So again, it's very important to only proceed to having external hormones only if I tried and I compensated and I treated and then I'm not getting a withdrawal, then I consider the hormones. But I can by no means consider hormones if I'm not properly treated, if I'm not properly restoring my energy and restoring my availability.
Yeah, you are discussing about treating patients already that are amenorrheic and taking oral contraceptives, which is not even the ideal scenario because, these patients need to eat. That's it. You stop your level of energy or efforts that you're doing and just eat.
Restore your balance.
That's the thing. But I'm saying no, if a female is fine and she's physiologically fine and she's, for example, with a partner or married and she wants to take these implants that can cause secondary amenorrhea.
Now again,
so is this healthy?
If the purpose for taking them is contraception, the implants are fine. What I don't like are the injectable contraceptives. Because it is proven that injectable contraceptives can lead to osteoporosis or a loss of bone density in addition to affecting fertility on the long run. But when we talk about implants are fine if they're used for the purpose of contraception, but not for the purpose of inducing amenorrhea. You need to be healthy. Yeah. That is the thing. You need to be healthy. If you're looking at a long-acting contraceptive method, then that's getting an implant is fine if you don't have a contraindication to using an implant.
Okay, understood. So now we're coming to an end, and we would love to summarize this, Dr.Asil. This is really an endless talk. I just love it. I just love to understand what females are going. I just have one last question just before we end.
Shoot.
So, Why do some athletes tend to look more masculine, especially when they are doing activities such as CrossFit? To be honest, I can see some masculine features.
It's probably building their muscle, like their muscle mass, and there is a say about like leading, like getting your hormonal cycle or hormonal imbalance. That can be sometimes an override of testosterone level. So it can be
Okay.
sometimes, because again, we sometimes get like what the masculinization is a feature of increased level of testosterone. And
All right.
yes, so it can be due to an elevated level of testosterone, but that doesn't happen overnight, and that doesn't happen in a short term. It needs.
So do you think they have hormonal imbalances?
It can be,
Or
or sometimes it can be an external source of hormones, which I don't prefer.
Okay.
Because sometimes, again,
Okay.
an external source of hormones can lead to this. But it can be, on the other hand, like it can be, let's say, a combination of pathologies or a combination of etiologies. Because, as I said, when we talk about, let's say, polycystic ovarian syndrome, they can have an increased level of testosterone, and that leads to more masculine or more androgenic features.
All right.
So,
All right. Understood.
so it
Anyway,
is definitely an increased level of testosterone.
Testosterone.
Yeah.
Yes. Yeah. This is a huge topic. As I said, endless topic. The thing is, we're running out of time because we don't want the audience to get really bored, and we're trying to limit it to 45 minutes as much as possible. Dr.Asil, thank you so much for having. Yeah, we're happy to have you today, and we hope we can have a second chance to get and continue this. But what would you like to advise? Is there anything you would like to recommend?
Again, it's our responsibility as healthcare professionals, you as educated athletes, to raise more awareness, whether it's to coaches and instructors, whether it's to the athletes themselves. Take care of your reproductive health as well.
Even in schools.
Yes.
In schools, I think in school.
Because as you said,
there should be some,
they're exercising at an earlier age. They're like choosing sports and taking it to a higher level or to another level, to a professional level at an early age. So just give more attention to the association of your reproductive health and your hormonal menstrual cycle to your performance and exercise behavior. That's a first. And second, don't always rush to pharmaceutical or to pharmacological interventions. The preliminary intervention is basically to look after your health as in quality of life. Just look after your intake, your output, and balance it, and then go ahead. If it doesn't work out, then pharmacological methods are available. Just don't rush into them. And there's way more to our bodies than just numbers. You can be a competent athlete, but you can be a healthy woman and a healthy female as well. So just keep an eye on your bodies and your general health in addition to your numbers.
And my personal recommendation, honestly, to have OB-gynecologist specialist in align with the Olympic Committee, Federation in general. There should be a female doctor there on board for the female athletes. We hope that this will happen one day.
Inshallah.
And thank you so much again for your time.
Nadine.
It's really lovely talking to you, and have a great evening.
You too. Thank you for bringing attention to it. Have a good day. Bye.
Thank you. Bye.